of well-fixed humeral components. We've all been in situations of difficult revisions and removing well-fixed implants, and frequently significant steps are required to remove these implants. Most humeral stems are not loose and do require some advanced techniques to remove. Preoperative planning is important. You need to know your enemy. You need to know what your implants are. You need to know what the status of the soft tissues are, what you're going to be dealing with regard to infection and what have you. And you need to identify these implants and choose your implant that you're going to reconstruct with based upon what this is going to look like when you're done removing it. So you need to know your skills. If you have trouble identifying the implant, you can go to the University of Washington website or the ASCS Photographic Library to identify implants. And knowing what your implant is can help you order the extraction instruments from the manufacturer. Several of these implants require specialized instrumentation only available from the manufacturer. Ask an experienced surgeon how to remove the implant. One of the consultants here, you got consultants from every company, they can tell you how to remove these. Also, plan to have an antibiotic spacer, something to wrap around the bone for cerclage and fixation, including grafts and struts for reconstruction. We'll hear more about reconstruction later. Lack of planning ahead of time can lead to a very bad day in the operating room. So what do I order? My go-to instruments that will get majority of stems out are a pencil tip burr that can disengage the bond between the prosthesis and the bone, flexible osteotomes, and a footed implant for retrograde impaction. These three instruments alone will remove about 80 to 90% of the humeral stems. In addition, you may want to get some type of revision instrumentation. I like to have a C-arm available, although I don't use it all the time. And then for certain considerations, you may want to order special equipment. If you had a lot of cement in there, you may want one of the cement extraction devices, or there's a pneumatic osteotome that can be helpful as well.